So I want to say hi to everyone that has joined already. Hello to Dr. Ceja from our
Hello.
Tijuana facilities. Are you in our hospital or?
No.
Okay. So this is our last of the year 24 Rilla Surgery webinar informational about Mexico Bariatric Center. And we would start January, of course, and do the same. So this is our like holiday season version of Vela surgery. So I like to talk about the raffle first. So whoever has submitted a health questionnaire already in our system or is in our database, you don't need to resubmit that. This is for all the surgeries that Dr. Ceja can offer, and that's for Dr. Ceja only. So if you have not filled out a health questionnaire, please go ahead and go to mexicobariatricenter.com/health-questionnaire and select Dr. Ceja. Again, if you have submitted before prior to the webinar, you are good. You don't need to resubmit it again. Please watch the webinar to the end. We would release the poll, the Zoom poll, before the Q&A session, and you would need to fill that out and enter the raffle, and we do the $2,000 off of surgery package at the end of the webinar. Okay. Just since people are still joining, I'm going to talk about myself first a little. I started in my involvement in medical tourism in Mexico in about 2007. I traveled to a lot of the main hubs for medical tourism in Mexico. Of course, Tijuana is the main hub, and Guadalajara, Cancun, Monterrey, Cabo, and in 2012, I started Mexico Bariatric Center, MBC, specific brand, and we've been very successful since inception. And we started the project in 21 to build our own hospital facilities, and we just finished in 24. And we have one of the best packages out there for the most affordable prices. You see how we are the best in the business. Myself, I'm a Medical Tourism Association certified, and I attend I attend all the national and international congresses for obesity related events. We will try to cover the questions that pretty much everyone has, and if we missed those, you can still ask in the Q&A tab. Please make sure you pay attention so we don't have to answer the same questions again, because we have limited amount of time. Usually we try to get to all the questions answered at the end, but sometimes the time doesn't allow us to cover all the questions. So let's be selective of what we ask. Topics we cover today, of course, everyone knows about obesity and its risks. We will touch base on those. We find out how to calculate your ideal weight or your goal weight. And we talk about what weight loss surgery does. as far as resetting your metabolic system. And we talk about the Zempic a little bit. Then we talk about why MBC, why Mexico Bariatric Center. And we talk about packages, how to schedule, very easy, 1, 2, 3. Talk about all the support programs we have. And then Dr. Ceja is going to talk about all the options that we offer, including laparoscopic, endoscopic, revisional, reversal. We talk about financing at the end and our nutrition program, comprehensive post-op, pre-op program that we have. And a little about holiday tips and tricks. Then we release the Zoom poll. Please look for those and make sure you don't click on the wrong spot so you don't miss it. And that's the last of the session, and we try to answer questions that you guys have. At the end, like I promised, we do the raffle for $2,000 off. Basically, obesity is a multifactorial disease, we all know. And, you know, it's in the medical community is defined by what we call the body mass index, BMI, in short, and there's a formula that you plug in your height and weight, and you find out the number, and it puts you in a category, as you see in the chart, of under 25, between 25 and 30, which is now we are in the overweight zone, and after 30, obese, and then we go to morbidly obese and super morbidly obese and super morbidly obese. One thing about our center that is great, of course, not only we offer a full spectrum of all the bariatric procedures, we also can handle BMIs not up to, anywhere, even 110 BMI. We've done surgeries on those. So there is no limitation of what we can handle. So again, the obesity is attributed to so many factors, right? Increased nutrient content of food, right? All the ultra processed food, the sugary drinks, lack of physical activities, like in California, we are just used to sit in the car, go to our work, come back, eat, go to bed. These are just, contributing to all this. Of course, genetics is a main factor. And then again, at night, we are stressed out. We eat, comfort eating, stress, inadequate sleep. We're used to large portions of meals. And what happens is when we gain weight, before the belief was, okay, you just increase your body fat cells or adipose tissues. And after a while, they figure out it's not just the number that is increased. The structure of the adipose tissue, as you see in this picture, is also changed. And the structural change of the adipose tissue or fat cells is contributing to all the problems, right? To like insensitivity to insulin, diabetes type 2, insensitivity to leptin, to vaccination. Our muscles don't respond to protein and exercise even like it would do if we are not obese. And that's the start of the problem, and is a major risk factor. 40% of adults in US are impacted by obesity. It affects all parts of our body, including our lungs. This is the animation that I like to show always. So again, so many problems come with it. Comorbidities, heart disease, lung disease, diabetes, chronic inflammation, uh, impaired immune system. During COVID-19, we learned that being overweight and obese is a major risk factor for catching the virus, ending up in the hospital, ending up in the ICU, and higher risk of actually dying. And the reason again is because the protein, the coronavirus protein likes to attach itself to fat cells. The more fat cells, there's more places to attach itself. So that's very simple. Um, okay, let's see what's happening. Okay, now you ask me, what's the okay? So we learned that we need to live a healthy life. We need to lose weight, and of course, diet and exercise is essential. But if we have so many pounds to lose, is not a proven long-term solution for obesity, and we're going to see why. And then it comes magic pills. Since the beginning of human history, people try to find some magic pill to take, or in this case, is an injection to lose weight. And again, these are not proven long-term solution to cure obesity. Still at this point, as we speak, bariatrics is the proven, quick, safe, and long-term solution to lose weight and keep it off. So diet and exercise. I promise to, okay, so diet and exercise, in this case, let's say I'm an individual who weigh 250 pounds. I have about 75 pounds extra, right? And my body is used to this weight. My brain, my hormones are interacting around this set point, right? If I go on extreme diet and boot camp type of exercise and lose, let's say, manage to lose 75 pounds, that's huge. My body thermostat, your metabolic thermostat or system is trying to pull me back to 250 because that's what it used to. And the longer I was at 250 pounds, the harder it gets to lose the weight and keep it off. So what it does, it would make me more hungry and my metabolism goes down. So it doesn't burn fat and I want to eat. So my body goes back to where it's used to, where it's comfortable. Now, when you do bariatric surgery, the minute they do the surgery or operation, because the hormonal changes, and of course restriction as well, it resets your metabolic system. So this is where the magic is. Bariatric surgery resets our body's metabolic system. So right away, when you wake up, your body, your brain, and your hormones are seeing you at 175 pounds. So we want to take you down to 175 pounds. And what it does is you won't be hungry as much and your metabolism goes up, which means the extra fat is burning. And that's the magic of bariatric surgery. Now, I was talking about, okay, so my ideal weight is probably 175 pounds. So how do I figure that out? Okay, so there is a chart in front of you that you see based on male and female, frame size, the height. You can find out what is your ideal weight, right? So let's say if I am 5'8", and have medium size frame, I need to be around 154, right? And so let's say if I weigh 204, so that means I have 50 pounds extra, and that is my extra weight that I need to lose, right? And usually they come up with, okay, so what is the percentage of sleeve of extra weight you lose, or how much do you lose of extra weight bypass? But there is no limitation. I mean, we see our patient that lose all the weight that is extra, so they get to their goal weight, whether they bypass sleeve. Of course, there is a small portion that they don't get to their goal weight, and then that's when they need revisional surgery that we're going to cover a little later. I promised to talk about Ozempic. Okay, so Ozempic and Manjaro, Wegovy, all these medications, they came up with the idea to create synthetically. So this is a fake hormone that is trying to simulate the hormonal changes of the bariatric surgery. So on the right, you see all the hormones that get changed when you go through bariatric surgery. Look at how many there are. At least 10. This is the 10 that I put in. There are more. GLP-1 is one of them. And that's one of the things that Ozempic has, right? And then some of them has another component, which is a GIP. But beside that, first of all, they're synthetic. They're not real. They are injecting to your body, and they're not naturally occurring when you do the surgery. And on top of that, you have restriction that they create during the surgery that you don't get with Ozempic. So what is happening is over 60% of people who start Ozempic, they don't continue because of side effects that you see here, short-term, long-term, and of course the cost. And there is a lot of, fake medications that you totally want to avoid because those are detrimental. So please make sure if you use Ozempic or anything like that, you're using the brand name, and don't fall for the advertisements online for cheap. And of course, if you are Ozempic and you're still getting weight loss surgery, you need to stop Ozempic 2 to 3 weeks before surgery. Now, we are working on an article. Actually, it's going to be a blog post that is coming out very soon, that we did a survey from our patients who were on Ozempic and they switched to bariatric surgery with MBC. And it's not one or two. You will have, by next time, we will have that published, and you see. Saying all that, this is a pyramid that show you the effectiveness of different tools to lose weight, right? Diet and exercise, again, not work for everybody. Semaglutide injections like Ozempic, small portion of population may work. Now we go to endoscopic procedures like gastric balloon and endosleeve. And then we do the surgery part, surgical intervention of obesity, which is gold standard, like bypass, RMY gastric bypass, endo gastric sleeve or VSG, duodenal switch, all those that we will cover later. So the bariatric surgery is a really effective, like I said, tool to cure obesity. However, it's not easy to receive bariatric surgery because the insurance companies either don't cover it or make it very hard to approve you. This is a life-changing surgery. But if you like, for example, in Canada, you have to wait a few years to receive it. Like I said, this is a life-changing procedure. And so what do? You look abroad. You look to Tijuana, which is a main hub, like I said, for weight loss surgery right now. And MBC is number one provider of bariatric surgery in the world right now. So we are offering this at a discount with an all-inclusive package. And all you have to do is get the flight or drive to San Diego, and the rest is on us. Again, we will talk about why you want to go with a company like MBC, right? Even CDC in the US recommends that you go with a coordinating or facilitator company like us, because we manage all the movement once you get there, making reservations for you in hotel, hospital. You don't have to worry about a thing. So we bring peace of mind, and we offer a complete array of the surgeries. So we give you exactly what your body needs for future health, changing your life, and the best outcome. Again, basically, MEC is peace of mind, right? We are a US based corporation. Our main office in Sacramento, that's where I'm right now, in Folsom, actually. And our commitment has been since the inception to provide the highest quality weight loss procedures at the most affordable prices. MBC started in 2012, so pretty soon we will be 13 years in business, over 25,000 successful surgeries. So these are not just numbers that we're throwing out. Since we started putting these numbers out, everybody is just saying, oh, yeah, we have 5,000, 10,000. I promise you, a lot of them are not legit. They just want to pretend that they are good like NBC. We work with 5 teams, independently staffed bariatric surgical teams. These are different teams. They're not like 5 just names we're throwing out there for you. Okay. I will show you a bulleted point of what we offer that makes us unique and number one. This is just a highlight, right? The surgeons we offer, none of them has less than 5,000 surgeries behind them. And these are not, again, these are numbers that we have in our database, and we get it from the database. Our experience, our reviews on Google, Facebook, the videos we have out there, you can go look at videos from back in 2012, 14, 16. We're not a fly-by company. The quality that we offer, especially with our hospitals that we open, and the treatment you get down there. And this is bulleted point of why MBC. There is no company that can match what we are offering right now and the prices we offer right now. And then a lot of the, surgeons from other parts of Mexico has traveled to Tijuana, and they want to jump on the bandwagon of medical tourism. and some of them are assistant surgeons. Some they just offer very limited type of procedures, and they actually what they do is they convince you to get the procedures that they can offer only and not what is really good for you because of the limitation they have. And I always compare assistant surgeons, experienced surgeons with pilots, right? You want to be with a pilot that has hours and hours of flight time. And most of the time, the flight doesn't, nothing happens to the flight, but there is that one time that you need that experienced flight pilot or the surgeon to rescue you. And you basically risking your life by going with the inexperienced surgeon. So what I want to pay attention is the research that you need to do, because the social media is great, but it also could be misleading. If you are price shopping, or you can go on Google and pay Google to show your ad up in the first spot, but what is behind that company? You don't know. Um, you can put TikTok, Facebook ad, very nice, beautiful ad, but who is behind all this? Who is behind the website? What are their credentials? Who is running it? Um, well, my face has been out there since the inception. You know who I am. Our surgeons are out there. We know who they are. There's no mystery about MBC. So you have to consider all this. And with the start of our hospital, which is called Hospital Azar, and I'm going to show you a little video of it here. Um, Azar, that's a Persian name, and it comes from ancient Persians that is showing faith, integrity, and inspiration. And this hospital is the top of the line, one of the best facilities right now in Tijuana, Mexico. We have 4 operating rooms with the state-of-the-art equipment. The rooms, great views, comfortable. We had patient experience in mind when we designed that. I worked with the best team of architects and doctors and surgeons to create this center for 3 years of work. And now, about getting to have surgery with us, that's streamlined as well. All you have to do is fill out the health questionnaire, make sure all your information is there. And once you get your approval, about 95% of patients get approved. The 5%, we do what is called conditional, and we probably need some more information from you. And once you get that, you can actually book yourself online. You can find what days available for that surgeon, make a deposit online, and book yourself. And of course, our staff going to reach out to you. But now all you have to do is fill out the paperwork. If you're flying find your flight to match the hours that we want you to come and your departure time, and that's it. Um, our packages are all inclusive, which means is covering all the expenses from surgeon fees, standard medication fee, private transportation before after support, nutritional support, and we offer deeply discounted medical tourism insurance, optional, but is at $179. And I'm going to show you what it covers. And please take advantage of this opportunity because this is about 30% of the cost of if you were to purchase it on your own. Again, our support groups, we have several Facebook support groups. The main one is about 13,000 members, all active. They're sharing their before after pictures. This is a great place to keep up with your weight loss journey. And we have events, our coordinators go live, our nutrition um, um, webinars at least every other week or every week for pre-op post-op. Our nutritionist is active, will talk to you. And then, of course, we have our team of past patients that are working with us. This is our affiliates, Sarita, Rena, Kelly, Jamie. We have several of those past patients that they love us and they're working with us to support the future patients. Actually, Sarita and Rena, they do a podcast. I suggest that you listen to those. It's a great opportunity to learn what is life before and after. Um, so again, for people, I noticed some people joined us after. If you guys have filled out the health questionnaire HQ before, you don't need to redo it. But also remember that this is for Dr. Ceja only. So your surgery is going to be with Dr. Ceja if you win. I would release the Zoom poll before the Q&A session. Please be present to the end of the webinar, and we would draw the name at the end. These are 5 teams of best bariatric surgeons in Mexico and probably worldwide. I tell you what, we have scholars coming from South America, from everywhere to watch our surgeons do surgery, and they do internship. Um, this is the team. Dr. Miguel Montalvo, Dr. Alejandro Gutierrez, our chief surgeon, Rodriguez Lopez is our super surgeon. Dr. Usuna has been with me from 2010. Amazing surgeon, individual. Again, they're all great. I can't say enough about them. And Dr. Jesus Ceja, which is present today, well-respected surgeon in Tijuana. Our support system. When you submit your health questionnaire, it goes through what we call surgeon liaison. She's a bilingual doctor. She sits in between you and the surgeons and makes sure all the information is transferred back and forth. And we have algorithms over years that we have developed. We know which surgeon matching best with which patient. So when you submit that, we have criteria that determine which surgeon is best for you. Of course, you can select the surgeon, but we would do that for you. If you don't, our surgeon liaison is going to monitor all this and you get the best option for you. And we have no limitation of what surgery you can get. So it's not like we force you to get a sleeve because we can't do the high BMI bypass. Or if you really need a DS, do adenal switch, we will not tell you, well, that's not good for you. Let's just get sleeve or bypass. If you are opting for endo procedures, we could do that. If you think balloon is good for you, if your BMI is low and you just want a jump start in your weight loss, we use Hyatt. Our pre-op diet is very simple, straightforward. It goes based on your BMI, and it can range anything from few weeks to 2 day of clear liquid. Of course, everybody would do the 2 day clear liquid, but you may need more than that. And you know what? The pre-op diet is very important because you make a commitment, and that commitment is going to be essential for your long-term success with the weight loss surgery. Remember, the weight loss surgery is just a tool. 50% of it is you. You need to step up, change your lifestyle, change your diet. But the tool is going to help you to do that, right? So the better pre-op diet you do, the better outcome, the easier the surgery on you and the surgeon, and the better recovery. Okay, please. Again, as a general rule of thumb, you need to stop blood thinners, NSAIDs, at least 1 week. No smoking, very important, before and after, please. Ozempic, if you're on Ozempic, please stop at least 2 or 3 weeks before surgery. And our surgeon liaison and coordinator is going to give you instructions of what medication to stop and start. If you are taking a medication on a regular basis, please bring the bottle with the label to Mexico. We want you to show up at the San Diego International Airport before noon and depart after 2 p.m. We use medical pass to bypass the 3-4 hour wait sometimes. Again, some days like Sundays, if it gets late, we have no control, but we will do our best to get you there on time. That's why we want you to have passport, so there is no delay on crossing. Again, when you arrive, we do all the tests necessary, your blood tests, your EKG. We put you in Hyatt or whatever hotel that you're assigned, or hospital Ozar. We provide broth, jello, ice chips. Your companion stays with you the first night, stays in the hotel after you go. This is huge. Companions do have visiting times in the morning and afternoon. And that's plenty. We have plenty of nurses that are taking care of you. Believe me, when I walk through the corridors at night and I see patients, either they're relaxing or asleep or even walking around, it's such a serene environment. If a hospital allows the companion to come to the hospital, it has so many ramifications. As far as disease, as far as traffic, it has so many inconveniences for patients. Yes, you want your companion there, but if a company tells you that they keep your companion in the hospital, that hospital is not up to code. Here's something I can promise you. Our hospital is according to the government of Mexico's code. And this is pretty much international codes that we comply with. We didn't bribe to start our hospital. It's based on the best practices internationally, like a JCI international certification that hopefully we will get soon. But the hospital has certain codes and protocols that for the safety of patients we comply with. Okay, everything we do is for your safety. Remember that. um, on the day of surgery, if you're in a hospital, you just go to the OR. If you're not, you show up in the lobby, they pick you up, they take you for the surgery. You stay one night if you are endo, 2 nights if you're um, sleeve, 3 nights if you bypass or DS. We do multiple leak tests, amazing patient care, and you're out to go back home. If you need to stay extra, talk to your coordinator, we can arrange that. And you can still have option to stay either before we pick you up or after we drop you off, to stay in Hampton Inn by the airport. If you mention Mexico Bariatric Center, they have a special rate for you, because I know the hotel prices through the roof, but they have, I think, $169 per tax. Again, those are all options for you. Um, Again, our nutritionists usually go over this. This is pretty much phase one, phase two. So post-op diet is basically you go from clear liquid to solid in 4 weeks, in 4 stages. This all will be emailed to you. Again, you can jump on a webinar, learn from all that. It's no problem. Another success we have, because we have complicated algorithms, database, we manage our surgeons' load on a daily basis between the expertise of the hospital, the fact that we are specialized in one type of surgery. We're not doing knee surgery and heart surgery and emergency walk-in. This is all day to day. We're doing bariatrics and plastics. That's all we do. With the management of the surgeon's load, we don't make him tired. We don't exhaust them on a daily basis. Our complication has been consistently less than 1%. Well, this is the last data we had is 0.07%. So this is the complication rate that in US is 2.8. We are less than 1%. You ask me why MBC? That's another reason why MBC. Now I'm going to talk about Dr. Ceja a little bit and let him take over and talk about different things. Dr. Ceja is a highly educated board certified surgeon in Mexico, of course. He's double board certified, and he has done easily thousands of surgeries. He's, as you see, he's still very young. And that's another thing, because these are done laparoscopically. So you want a surgeon that is not only has experience, but is also young. So they would have full control over eye-hand coordination. Okay, so that's another clue. Again, I mentioned the type of surgeries we offer: sleeve, VSG, mini sleeve, single incision, arm-wide bypass, mini bypass, duodenal switch we call DS, single anastomosis DS, which is SADI, revisional surgeries from old surgeries to band to sleeve, band to bypass, sleeve to bypass, you name it. We even do reversal, and of course endoscopic procedures like gastric balloon, ESG, which is endoscopic sleeve gastrectomy, like Dr. Ceja is going to explain, and TOR, which is revisional of a bypass surgery. Soon we are going to offer robotics, but robotics, is really not necessary for a center like us. You know why? Because our surgeons are the one that actually perform the surgery. They're not just a name and then another inexperienced surgeon come and do the surgery. So so the surgery doesn't cost as much. So they do the surgery, they are experienced, they're young, they do every surgery like this is the only one they have to do that day. Okay. So anyway, Dr. Ceja, please go ahead and take over and explain all the procedures for us. Thank you so much for taking time. Go ahead.
Okay. Hello, everybody. We start with the most common bariatric surgery, the gastric sleeve. In this type of surgery, we remove approximately 75 to 85% of your stomach. It depends the patient. Using an average 44 incisions. Sometimes I use one more incision. It depends your liver size. It is a restrictive type of surgery. The patient after surgery will be able to eat small amounts of food. After the gastric sleeve, the hormone ghrelin decreases, called the appetite hormone, and other hormones such as GLP-1 increase. The main advantage gastric sleeve is a quick and safe procedure. Helps improve diseases related to obesity. For example, diabetes, high blood pressure, apnea. There are no changes in the anatomy of the intestine, and the recovery time is really fast. The most important disadvantage is that you can develop acid reflux after surgery. It depends on the patient, but average 10 to 15%. The weight loss with this surgery is 72%. The average duration of this surgery is 1 hour. Hospital stays is 2 nights, and recovery is 1 to 3 weeks. This depends what do you do. Next, please. The gastric, the single incision. This surgery is performed through a single incision through the belly button. The main advantage of this surgery is aesthetic. This surgery has the same results of the conventional gastric sleeve, and the stomach removed is 80% in average. Candidate patients must have a BMI less than 40. The duration of this surgery is 1 hour and a half, approximately. Hospitalization for 2 nights, and recovery, it's the same gastric sleeve, 1 to 3 weeks. Next, please. The endoscopy gastric sleeve is an option for patients have high surgical risk, or for patients who have a low BMI, less 30, 32, less 30. Weight loss with this procedure is less than 40% of excess weight. Is less effective in comparison with the conventional gastric sleeve. The duration of this procedure is 30 minutes or to 1 hour. It depends the surgeon. 1 night of hospitalization, and recovery is faster, 1 week in average. Next, please. Gastric bypass RMY. During this surgery, a small pouch is created at the top of the stomach and connected directly to the small intestine, bypassing a portion of the stomach and intestine. This reduces the amount of food that can be consumed and absorbed. In this surgery, GLP-1, a hormone that helps control diabetes, is increased. It is the gold standard for treating morbid obesity, significantly improves diabetes, and high blood pressure is in up to 80% of patients. It is the best option for patients with acid reflux disease. This is the main procedure for this type of patients. The main advantages are two. One, the patient may develop dumping syndrome, and two, may have an increased risk of gastric ulcers, both caused by the direct connection of the stomach with another portion of the intestine. The duration of this surgery is 2 hours. In general, 3 nights of hospitalization and recovery 2 to 4 weeks. Next, please. What is the best surgery for me? In this image, we can summarize advantages of both surgeries. Each patient must be evaluated to know which is the best option. For example, a patient with severe acid reflux disease, the best option is a gastric bypass. If you have a BMI 30, 35, 40, the best option maybe is a sleeve. It depends each patient. Next, please. Mini gastric bypass. It is a surgical procedure that involves creating a small gastric pouch and attaching a part of the small intestine to this pouch. Unlike traditional gastric bypass, only one anastomosis is performed. The weight loss with this surgery is approximately 75%. It is an excellent surgery that effectively controls diabetes and high blood pressure, apnea 2, and pain joint. The main disadvantage in this type of procedure is that patients may develop bile reflux. It is a safe, effective surgery. The duration of approximately 1 hour and a half, 2 hours. Hospitalization time and recovery is very similar to gastric bypass RNY. Next. Here we have a comparison between both surgeries. The main advantage of gastric bypass RNY is minimal risk of developing acid reflux, but increased risk of gastric ulcers. This is because we do 2 anastomosis. Both surgeries have similar results in terms of weight loss and improvement in diseases related to obesity, such as diabetes, high blood pressure, and apnea, high cholesterol, etc. Next, please. The duodenal switch, it is a malabsorptive surgery, very effective, complex, and with good long-term results. Patients lose up to 80% of excess weight in the first year after surgery. It's very effective. Control of diabetes is more than 90% of patients. The main disadvantage is increased risk of malnutrition. The duration of this surgery is longer, 3 hours approximately. 3 nights of hospitalization is the same, the gastric bypass, and recovery 4 weeks. Next, please. This is the difference to the duodenal switch, complete or duodenal switch, only one anastomosis. The name is SARIS. It's very similar, the results are long term, and it's very effective both procedures. Next. If you have a polycystic ovary syndrome, it's really effective, this type of surgeries, metabolic surgeries, because approximately more than 95% of patients can be improve this type of disease, and this is a really good option. maybe a lot of women patients choose this type of surgery because she or they want to pregnant, and it's a really good option. Next, please. How fast can I return to work after bariatric surgery? It depends of the type of job you have. Our recommendation for returning to work, for example, office work, 1 to 2 weeks, sometimes less. It depends what do you do in your work. If you work with light physical activity, 1 to 2 weeks. Fast paced, 2 to 4 weeks. And if you have hard work, lifting a lot of things, maybe it's better for you 4 weeks. Next, please. Our recommendations when you bring here in Tijuana, wear mask is optional, but I prefer you bring with you the mask, maintain the social distancing, test prior your travel, and vaccination is really, really optional, but it's better if you have the vaccine.
Thank you so much for explaining all the procedures we offer. And I'm just going to talk about real quick about financing. Our packages are extremely affordable, but if you need money, I would suggest that you look into if you have a good relationship with your bank, probably that's a good place to look for a loan. Credit unions, if you are a member of, and we have several providers that we have on our on our financing page. You can go through those like Super Money financing. Again, look into SoFi, Lending Club, but do not apply for so many loans at one time because it's going to affect your credit score. And one of the benefits of going with us is you get deep discount for medical tourism insurance, and that is $179 that covers all this. Again, is optional, but I highly recommend. If you were to purchase this directly from the company Global Protective Services Solutions, they would charge you about $400 or $500. So it would cover the time do you start your travel to Mexico and 45 days after you come back to US. So this is something we offer that you can take advantage of. Again, we have comprehensive nutritional program. We offer bariatric vitamins. These are highly recommended because it has exact ingredient that what you need with the best quality ingredient that you can take for long-term success. We do also offer MBC Nutritional Support Program, which is we call Support Plus. You can subscribe to those. These are different soft chewable, drinkable capsules, bariatric vitamin. We call emergebariatrics.com. You can purchase it before or after. And some tips to avoid weight gain during the holiday, try to avoid or limit foods like sweet potato pie or pecan pie, mashed potatoes, gravy, eggnog, drink extra water to wash out the sodium. Just take small portion. Be careful with cocktails and make sure you're active, right? Activity is what it is. I'm going to, like I promised, to start the Zoom poll here. And before I go, well, we could do that during. Okay, so let me. Um, okay, so I am going to see here. Okay, it's a five question poll that I just released. Please make sure you fill that out. Meanwhile, I'm going to, because there's one question about a patient asking, Brenna, asking that she's looking to several places to get gastric sleeve, and she had some negative reviews from us, which I couldn't find. So I'm going to try to share my screen. Let me see if I can do that. Okay. Okay, so this is live, as you see, is our reviews on Google. And guess what? We don't pay people to go do reviews or purchase followers. I mean, things like that. There's some of these channels you see that they have like 20,000 followers. They purchase a lot of these things, and that's how it shows those big numbers. But these are like, you see, the reviews are legit from like 3 weeks ago, right? A month ago, 5 days ago. Maria said, I can't say enough good things about Mexico Bariatric, and the whole experience was amazing. These are real patients. And another one, Sue, a week ago. These are all 5-star. I mean, yeah, I mean, once in a while we get bad review, but I mean, you see, I mean, this is just live. It's just live, right? With pictures, legit, they're not some purchased reviews or yeah. So back to our, okay, so we're waiting for people to do the Zoom poll. And once they do that, I'm going to start answering the questions with Dr. Ceja. So Dr. Ceja would cover the medical related questions, and I will be covering the travel side of the questions. Yeah, you guys doing good. Almost 70% of people did it. So hopefully we have it shortly. Okay. Now, here's another thing I want to mention since you guys are doing this. Make sure, because a lot of the companies are pretending they're Mexico Bariatric Center or MBC. We've had this in before, that they pretend they are us, like Sleep Train. Yeah. So Sleep Train was a mattress company. Everybody was trying to pretend they're Sleep Train. And we are like that. We're the NBC. We were the Sleep Train of medical tourism for bariatrics and plastics. So be sure that they're not tricking you. We've had these situations a lot before that still could be ongoing. We detected, of course, we go after them, but make sure they are legit. This is a legit company they're going with. I promise you, it's very hard to find a company that covers all the procedures that we cover with the quality that we cover. We see that often. The patients go, they either approve them for bypass or they say bypass is not good for you, but the patients really need to do bypass because the surgeon or the surgeons they have, they're not capable of performing bypass or DS, or they can't do it on a high BMI. So they convince the patient, oh, okay, we'll just get something else, which is not really good for you. Long term, it has long term implications. Um, so if you're not flying to San Diego International Airport, you could either, some people are comfortable driving to Tijuana. You can drive to Hyatt, or you can park in the San Diego International Airport area and then go with their shuttle to the airport terminal and then get picked up. The day before your travel or the day before your arrival, our transportation team is going to contact you and tell you, okay, first of all, my name is Willie or whatever. They introduce themselves and they tell you what to expect. They know when you arrive. So they tell you when you arrive, just if you, first of all, please um, pack light. Don't bring more than one suitcase. Hopefully, just a carry on. Bring clean outfit for after surgery. Don't wear the same outfit you had before surgery, after surgery. You want to be clean. And also pack lightly when you arrive. If you have a carry-on, you just walk out to the curb. You see there are letters in the side. So there are two terminals, right? There are two terminals in San Diego International Airport. One is Terminal 1 is Southwest, which is going through renovation. Hopefully in 25, we would have all the mess go away. And we will have a brand new terminal. And for the other term, for Delta, United, all those goes to Terminal 2, which is a newer terminal. Again, either way, you just walk out, go to the curb, and tell the driver this is where I am, and they come and pick you up. Very simple. Okay, so we're gonna start answering the questions because I feel like they're almost everybody did fill out the Zoom poll. Okay, so they're asking about extra skin. I mentioned we do bariatrics and plastics. Mainly post-bariatric patients. Our surgeons are plastic board certified and they do specialize in post-bariatric patients because post-bariatric patient has a different skin, different situation. So you have to have a surgeon that is comfortable with that. Now, do you get excess skin? Sometimes. Depends on your genetics, your skin elasticity, how fast you lose weight, you know. If you exercise, you probably won't get as much or you won't get many, much of the loose skin. But then it's like a case by case. If you did get it, you come back with us. Mexico Cosmetic Center is our sister company that handles all that. Okay. So there is a question from Alma. Dr. Ceja is asking, what is the recovery rate? And I'm not sure what it means. Recovery rate of a revision from gastric sleeve to bypass.
The recovery is similar to bypass primary. It's 2 to 4 weeks. Yes, it's very similar.
The next question is hospital in Guadalajara. Okay, so I mentioned a lot about our facilities in Tijuana. We do have surgeries in Guadalajara as well. Dr. Usuna is basically working half time in Guadalajara and half time in Tijuana. If you need to go to Guadalajara, a lot of the patients like to go there because their family members are there. They do a visit and they get surgery. We can give you option to stay with your family if you want, and then go to the hospital and go back, or however you want. We can customize those. So yes, we do surgery in Guadalajara, but the hospital facilities that I showed you, Hospital Azar, is the one in Tijuana. So okay, so we got that. Okay, from best of my knowledge, so right now we have 2 slots for companions to come visit you. One is 10 to 12, one is 5 to 7. And there is transportation. As a matter of fact, if you stay in Hyatt, our facility, our facilities is only 3 blocks away. Okay. So literally you can walk back and forth. But I do believe that they give you transportation for different visitation times. Okay. But if not, it's very close. Is you can pretty much, I mean, we are really high. The first floor of our hospital is really high. We can see from our hospital, we can see Hyatt. So that's how close it is. Um, okay, we got that. Do you want to talk about ulcer and GERD and acid reflux, right? And then we talked about it when you were talking about sleep versus bypass and all that. But if you want to touch base on acid reflux, like what causes acid reflux and what you should expect after surgery?
If the patient decide for gastric sleeve, is common, 10%, that the patient develop acid reflux. But sometimes these patients have hernia, hiatal hernia too. And during the surgery, I fix the hernia and I perform the gastric sleeve, and the possibility of develop acid reflux is less. But some patients take a lot of medicine for acid reflux. In these cases, I recommend the gastric bypass primary. Is the best option for this type of disease, the acid reflux.
They're asking, can we use personal credit card? Of course. We have several options for you to pay. The easiest probably is Zelle, and you can do bank transfer. A lot of patients pay the deposit with credit card or Zelle, then bring a cashier's check. Your balance is due 15 days before the surgery because we have to know, as far as financial consideration, how are you going to pay. And if you would bring and cash your check, please send a picture of it to us so we know if you bring in cash. However, but you do have option to pay credit card. There's a 5% charge on the credit card payments, so you know. Brenna is asking about our reviews again and saying there are some bad reviews on Google and Yelp. Well, I showed you the Google. What happens with Yelp is Yelp usually likes to keep the bad reviews and throw out the good reviews. And from our experience, we don't want to generalize this. In Yelp, they try to get us to advertise with them, and we don't. And therefore, you don't get treated the same as you if you had account with them and you pay them. So we've had this issue with them forever that they keep the bad reviews and they throw out the good ones. Like we have 50 good reviews and we have one bad review. They keep the bad review and they throw out the good reviews. And we've had this hassle with them from the beginning. So just be, and that's why a lot of companies don't want to have Yelp reviews because of what Yelp does. This is just our experience. Um, I did mention about the prices. Um, I'm just gonna bring it up again in case we missed out, or when I was talking about all-inclusive packages. There you go. Those are our starting prices. But of course, if you have high BMI, things like that, it changes your. Okay, about the hernia repair. Dr. Ceja, you want to mention about hernia repair and how you inspect if they need to be repaired?
During every surgery, first I do a exploratory laparoscopy, and if the patient have a hiatal hernia during the dissection of the hiatus in the stomach, I always repair the hernia because this is the best option for the patient. But it, always I do a revision of the hiatus.
So we always publish the recording. We also is on our Facebook as well. If you need a link, contact us. Again, if any of these questions don't get answered, please don't hesitate. So in the hospital, everybody gets their own room. There are limited number of double bedrooms in case you need it, but usually you get your own room. You want to talk about revision of a bypass? What are the options, like even TOR and regular? What are the options if you need a bypass revision?
If the patient need bypass revision, first I need to look the gastric bypass previous in the laparoscopy. Some patients need a reduce the size of gastric pouch, or patients need manipulate the intestine for improve the malabsorption about this surgery. It's very, all patient is very important to know because it's different in each patient. But it's very know how is the previous gastric bypass. So the all patient, a lot of patients have the first surgery in USA, and I don't know how is the previous gastric bypass.
Again, back to these reviews. Remember, we are a transparent company. I mean, we don't manipulate things. We don't purchase these reviews or pictures. These are real stuff. And, you know, we have 97% satisfaction from our patients because we do we send them a link after they go back home to ask about their experience, and we get 97% satisfaction consistently. And of course, you know, there's that one patient once in a while that they're not happy, right? Something they don't like. So, but again, is real. You know, these are real numbers. We don't manipulate them. If you see a company has 5-star reviews, you have to run. If a surgeon tells you that they had no complication ever, you have to run because they're lying to you. You know, these are surgeries. These are real stuff. You know, you go into a different country, you're getting surgery. It's the real stuff. So if somebody draw a picture for you, perfect picture, you need to run because they're not telling you the truth. That's why we have MTI. That's why we do pay attention to all these details we pay attention to. Believe me, we work around the clock with our staff down there, with our surgical teams, with our hospital team, with our staff here in US, myself. We are working 24/7 every day around the clock with our surgeons. If you need an intervention, they pull you to the surgery right away. The surgeons are always there to protect you, to help you. There's layers and layers of support. That yeah. So okay, so let's go back to the question. They're asking, do you? Okay, where to go? Oh, just okay. Okay, do you have to eat keto? Do you have to have keto diet after you do dental switch?
No, I don't recommend the diet keto because after switch is not recommend you because you need a lot of supplements, vitamins, specific after this type of surgery. Remember that this type of surgery is a more malabsorption, and you need a specific nutrients after surgery. I don't recommend this type of diet.
Okay, so do you, they were asking about crossing the border. So when you get picked up from the San Diego International Airport, they take you to Tijuana. Most of the time, there is no stopping. There is no questions. Of course, you have to go through the traffic to go through the border. Once you get there, they usually don't pull the cars and you go through no problem. Coming out, you have to go through the U.S. Um, um, border control, right? So again, we do have medical pass that we bypass the normal line, and we like to have, usually there are several patients in one car or a van or minivan. So please make sure you have passport and your documentation all straightened out so we don't run into problem when we go out. Okay, so if your flight it gets delayed or you miss your flight, you need to tell your coordinator and you the driver right away so we can find a workaround. Yeah, again, if you want to stay extra, either in the hospital or hotel, just tell your coordinator we arrange everything for you. We charge you, but we are going to arrange that. But as far as the charges, honestly, the rates that we're giving you is the lowest rate. Like if you were to book yourself with Hyatt, some nights there are $300. Actually, that's one because sometimes I go there without booking before, and that's how much they charge me, about $200. And so you're getting great rates for hotel, for hospital. You're getting this package we have is a great deal. If you see the components that goes into this package, then you would appreciate how inexpensive it is, and we try to keep it like that so you guys can afford it. Um, okay, I'm just trying to. So they're asking, do you still have a normal pregnancy after surgery?
Yes, the patients can pregnancy normal after surgery, but I recommend wait 1 year after surgery uh, for for this for pregnant.
So something about duodenal switch, because some surgeons believe that, or some companies say, oh, this is extreme, but really, some people do need to get SADI or DS, traditional DS BPD. I was reading information like some papers that come out, and they were talking about 15-year long-term results, and they were saying the patients who received DS had much more success than bypass. So again, every patient different. Every your age, your genetics, your lifestyle, everything is different, and that's why we try to give you the best option for you. Um, and as far as you know, let's see. No, Dr. Ceja is not performing in Guadalajara. The only doctor is in Guadalajara is Dr. Usuna. Dep- yeah, depends on me too. So the FSA, HSA, sometimes it works. Depends on the card you have. Please try on our website to see if it takes it on our payment page. I'm just typing that too as I speak. Okay, so I think we have about 40 or more we have about 40 more questions, and we have been already about 1.5 hours into this. Just one thing I want to mention is about the vitamins. For sleep, at least take bariatric, take emerge for 2 years post-op. For bypass, probably 5 years more, and DS probably for life. Okay, guys, let's get to the drawing of the raffle, and I have all these names. Then I'm going to pull one up out. So make sure I'm not looking, and I'm just pulling one out. Let me see. I hope I'm not messing up the first name. Quintia Robinson. So I am going to look for you and let you talk. I have the name up. Okay, let's see. Where does it go here? Okay, I'm gonna close this. And there you go. Attendees. There you go. So I'm going to allow you to talk. Please make sure you are not on mute. There you go. I want you to talk to us, please, and tell us where you're from. Tell us about yourself and how did you hear about us, and if when are you planning to go down there? Go ahead. And first of all, tell your first name so I make sure I didn't mess it up.
My name is Quintia. It's
Quintia.
Quintia. I'm from Atlanta, Georgia. I found out about you guys. I want to say via social media.
Okay.
I think I was looking around and I was looking for like information, and I think I ended up coming across you guys' web page, and I reached out to you guys, and somebody ended up texting me. They was trying to call, but I was at work. I work at the dentist. I'm a dental assistant.
Okay.
So I was in the midst of working, so I couldn't talk to her. So I had been texting back and forth. So we just been texting. My plan is to do it like March. That's
Okay.
my plan is March. I was trying to wait till all the holidays and everything was over. And my job kind of slowed down. So my plan is March. I don't know what else to say.
That's great. We appreciate you. Yeah, we have a lot of people from Atlanta. We actually used to go there for seminars, and after COVID, we ended up just doing more webinars. But again, well, thank you for sharing your story with us. Thank you, Dr. Ceja, and thank you everyone else who joined us. We see you in January. I want to wish everyone happy holidays and have a great time with your family and enjoy it. Okay, we see you in January.